Hey, you ever stop to think about what's going on in your mouth? Not that lingering taste of your morning latte or the spinach stuck in your teeth from lunch. I'm talking about the billions of bacteria calling your mouth home. Pause. Most of us don't give it much thought, right? We brush, maybe floss if we're feeling extra disciplined, and figure that's enough. But here's the jaw dropper. Those tiny bugs in your mouth could be silently raising your risk for a heart attack. Yep, you heard that right. Your oral health and your heart are way more connected than you'd ever imagine. Stick with me for the next few minutes, and I'll walk you through this surprising link. We'll unpack the science, share some real-life stories, and most importantly, give you dead simple habits to protect both your teeth and your ticker. Ready? Let's dive in. Let's start with a story to set the stage. Meet Patricia, a 42-year-old bakery owner who's all about her homemade sourdough. Picture her in her cozy shop, flour on her apron, chatting with customers about their favorite breads. Patricia's active, jogs most mornings, eats her veggies, and never misses her annual checkup. She's the picture of health, or so she thought. Last year, though, she got a wake-up call. At a routine dental visit, her dentist noticed her gums were red, swollen, and bleeding a bit when she brushed. "Just gingivitis," he said. "Floss more and you'll be fine." Patricia shrugged it off. Bleeding gums? Happens to everyone, right? No need to panic. Fast forward 6 months, and she's in the ER, clutching her chest, heart pounding like a drum. Doctors found a partial blockage in her arteries. Patricia was stunned. "I'm healthy," she kept saying. Then her cardiologist threw her a curveball. "How's your dental health?" Turns out Patricia's gum issues weren't just a minor annoyance. They were a clue to something much bigger. So, what's the deal? How do a few sore gums mess with your heart? Let's break it down. No jargon, just plain English. Your mouth is like a bustling city, teeming with bacteria. Some good, some not so much. The good ones help with digestion or fight off invaders. The bad ones, they're troublemakers. When you slack on brushing or, let's be honest, flossing, those bad bacteria throw a wild party. They build up plaque, that sticky, gross film on your teeth, and start creeping into your gums. That's when gingivitis kicks in. Red, puffy gums that bleed when you brush or eat an apple. If you ignore it, gingivitis can level up to periodontitis, a serious gum disease where your gums pull away from your teeth, forming tiny pockets where bacteria love to hide. Here's where it gets wild. Those bacteria don't just stay in your mouth. Inflamed gums are like an open gate, letting bacteria slip into your bloodstream. Once they're in, they can travel to your arteries, causing inflammation there too. And inflammation in your arteries, that's like rolling out the red carpet for heart disease, clogged arteries, or even a heart attack. Don't just take my word for it. Science backs this up big time. A 2018 study in the Journal of Periodontology followed over 1,000 adults for a decade. The results? People with gum disease were up to 3 times more likely to have a heart attack or stroke than those with healthy gums. 3 times. That's not a small number. It's a game changer. Another study from Harvard in 2020 zoomed in on a specific bacteria, Porphyromonas gingivalis, a common culprit in gum disease. They found it can trigger inflammation that thickens artery walls, making them narrower and more prone to blockages. Picture it like a pipe getting clogged with gunk, except it's your arteries and the stakes are way higher. Let's pause for a second. Pause. Ever had a moment where you thought, "Man, I should have paid attention to that warning sign"? That's exactly what happened to Steve, a 58-year-old truck driver with a love for the open road. Steve's life was all about routine. Black coffee at 5 a.m., long hauls across state lines, and a juicy cheeseburger at his favorite diner. His teeth, not exactly top of mind. He'd brush once a day, maybe, and flossing was a hard no. Too much hassle. Then he started noticing this weird jaw pain. Figured it was just stress from long hours behind the wheel. One day, while unloading cargo at a warehouse, he felt like an elephant was sitting on his chest. Heart attack. After emergency surgery, his doctor sat him down. "Steve, your gums are a mess. That's not helping your heart." Tests showed bacteria from his mouth had been causing low-grade inflammation in his arteries for years, setting the stage for his heart attack. Steve is now a flossing fanatic, keeping a pack of floss picks in his truck's glove compartment, but he wishes he'd known the connection sooner. All right, let's dig a little bit deeper into the science, because it's fascinating and a little freaky. It's not just about bacteria sneaking into your bloodstream like tiny spies. When your gums are inflamed, they release chemicals called cytokines. These are like little alarm bells signaling your immune system to go into overdrive. That's great for fighting off a cold or a cut, But when inflammation is chronic, it's like your body's stuck in a constant tug of war. That ongoing battle can damage blood vessels, making them stiffer and more likely to collect plaque, that fatty, waxy stuff that clogs arteries. Over time, that plaque can break off, form a clot, and bam, trigger a heart attack or stroke. The scariest part is, you might not feel any of this happening until it's too late. No warning lights, no sirens, just silent trouble.
Want more real-world proof? A 2023 study from the American Heart Association analyzed dental records and heart health data from over 60,000 people. They found that those with periodontitis had a 20% higher risk of heart disease, even when they controlled for other risk factors like smoking, high cholesterol, or diabetes. But here's the flip side. Treating gum disease, like getting a professional deep cleaning at the dentist, actually lowered inflammation markers in the blood. That's huge. It means taking care of your mouth can directly protect your heart. Another study from the University of North Carolina in 2021 followed patients who got treatment for gum disease. After 6 months of better oral hygiene, their blood pressure dropped slightly, and their arteries showed less stiffness. It's like giving your heart a breather just by brushing and flossing. Now, you're probably thinking, okay, this sounds serious. What can I do about it? Glad you asked. Let's talk about 5 stupidly simple habits to keep your teeth and your heart in top shape. These don't require a PhD or a complete life overhaul, just a little consistency. Here's the lineup. Brush twice a day, every day. 2 minutes, morning and night, with a soft bristle toothbrush and fluoride toothpaste. Don't just scrub like you're cleaning a grill. Get those back teeth and along the gum line, too. Floss daily, no excuses. I know, it's everyone's least favorite chore, but skipping it is like leaving dirty dishes in the sink. Things get nasty fast. Can't stand floss? Try floss picks or a water flosser for an easier win. Rinse with an antiseptic mouthwash. It's like a cleanup crew for your mouth, zapping bacteria in spots your brush can't reach. Look for ones with chlorhexidine or cetylpyridinium chloride for max impact. See your dentist regularly. Every 6 months is ideal. They'll catch early signs of gum trouble before it turns into a heart problem. Plus, those cleanings feel amazing. Eat foods that love your heart and teeth. Crunchy veggies like carrots, celery, or bell peppers act like natural toothbrushes, scrubbing away plaque. Cut back on sugary snacks. Bacteria thrive on that stuff, and it's no good for your heart either. Here's the thing, these habits are so doable. You don't need to run marathons or swear off ice cream. Just 5 extra minutes a day on your mouth, and you're investing in your heart too. Research suggests that consistent oral hygiene can cut your risk of heart issues by up to 15%. That's not just a number, it's peace of mind. Let's take a quick detour to answer some FAQs because I know you've got questions buzzing. Can bad teeth really cause a heart attack? Not directly, but gum disease ramps up inflammation, which boosts your risk. It's like adding kindling to a fire that's already smoldering. I brush every day. Am I safe? Brushing's awesome, but flossing and dental checkups are non-negotiable. Half the bacteria hide in those tiny spaces between your teeth. What if I already have heart disease? Talk to your dentist and cardiologist. They can team up to create a plan that keeps your mouth and heart in sync. Are electric toothbrushes worth it? Many experts say they clean better, especially for gums, because they do the heavy lifting for you, but a manual brush works if you're thorough. What about genetics? Sure, family history plays a role in heart health, but good oral hygiene is like an extra shield you can control. Can mouthwash replace flossing? Nope, it's a helper, not a substitute. Flossing gets the gunk out. Mouthwash just polishes things off. Before we wrap up, let's zoom out and picture something. Imagine you're 60, maybe 65, out in the backyard tossing a ball with your grandkids. Or maybe you're hiking a trail with your partner, feeling strong, no nagging worries about your heart. That's what these small habits can protect. It's not about being perfect, it's about showing up for yourself with a few smart moves every day. Patricia's back to baking her sourdough, experimenting with new recipes, and smiling without worrying about her gums. Steve's still driving his truck, wind in his hair with a pack of floss picks in the glove compartment, and a new appreciation for his health. They both learned the hard way, that your mouth and heart are teammates, not strangers. Let's talk about why this matters right now. Heart disease is still the #1 killer worldwide, claiming millions of lives every year. And gum disease? It affects nearly half of adults over 30. That's not just stats, it's people like you, me, Patricia, and Steve. The good news, you've got more power than you think. A little extra care for your mouth can go a long way towards keeping your heart beating strong. It's like putting money in a health savings account. Small deposits now can pay off big later. And who doesn't want that? So here's your call to action. Grab that floss tonight. Yeah, tonight. It's one tiny step that could save your heart down the road. Your future self will thank you. And let's be real, your smile will look pretty darn great too.